Hi, my name is Jordan McNair, and this is my persuasive speech. I want you to think back to high school for a moment. Fun, right? Can you remember a good bit of information you learned? Now, specifically, I want you to think back to your high school PE class. Can you remember any one piece of information you learned from that class other than how many boyfriends your best friend Becky had? Well, unfortunately, most people can't. As someone who has had a poor experience with high school PE herself, I'm aware from firsthand experience how lacking the class can be. In America today, we have many preventable problems concerning our health and wellness, such as obesity and disease. Saying this in this speech, I'm going to communicate one solution to our health problems, and that solution is simply to fix our policies regarding physical education in schools, starting with local South Carolina high schools. To start off, let's talk about how a lack of good physical education can negatively impact our lives. Our physical education system in South Carolina doesn't promote lifelong habits concerning being physically active. This leads to sedentary behavior and health issues in our adult lives. In fact, because of this, millions of people have been classified as being inactive. In the article titled Mapping the Prevalence of Physical Inactivity in United States in 2016, Rupung An and his co-editors state that a substantial proportion of American adults remain physically inactive. Among the 50 states and District of Columbia, 45 had over a fifth of their adult population without any leisure time physical activity, and 8 had over 30% without physical activity in 2015. So basically, his study proved that over a fifth of the population in almost every state were titled inactive. Saying this, activity is something that is crucial to our health, and inactivity can lead to preventable health problems in the future, such as diseases, psychological disorders, and obesity. For reference, in his book titled Predictive Factors, Health Risks, and Psychological Implication in 2016, Dr. Ahmad Al-Khatib says that sedentary lifestyle and physical inactivity are causes of major health risks, including cardiovascular disease, diabetes, and cancer. Another health issue that is commonly seen from inactivity is psychological distress. For example, in the journal Women and Health, written in 2018, Valigia did a study on women who stayed physically inactive and noted their psychological differences. She stated that leisure time physical inactivity was strongly associated with psychological distress, adjusting for age, workplace bullying, job demands, job control, social support at work, and traumatic life events, all in 3 female-dominated occupations. Efforts to increase leisure time physical activity level in medical occupations could be beneficial. So basically, she proved that participants had increased psychological distress because of inactivity. Obesity is another large problem due to inactivity. In fact, the article titled Obesity Rates Increasing in 2018, Bridget Kuhn found that states now have self-reported obesity rates topping 35%, according to new data from the CDC. By comparison, all states had obesity rates lower than 35% in 2012. That's an alarming number, and a lot of the reason for that is inactivity. Unfortunately, this increasing number of people with obesity become predisposed for many other health issues. In their 2018 article, Obesity, Pathophysiology, and Management, Dr. Gadd and her co-editors state that despite our failure to contain the high prevalence of obesity, we now have a better understanding of its pathophysiology and how excess adiposity leads to type 2 diabetes, hypertension, and cardiovascular disease. So, in other words, obesity can lead people to preventable diseases, and this is through activity. So, we said that inactivity can be caused by an inadequate amount of proper physical education as a kid, right? Well, how do we fix that? We can start by fixing our policies regarding physical education programs at local high schools in South Carolina. So right now, our policies regarding physical education are vague and non-demanding. According to shapeamerica.org, in 2016, they state that the state does not require a minimum amount of physical activity time for middle school and junior high school or high school students. Therefore, our state does not mandate a specific amount of time in which the students must be physical. In fact, shapeamerica.org also states that the state requires students to earn only 1 credit hour in physical education for graduation. This indicates that high school students are only required to take 1 year of PE class, which means that the other 3 years they aren't required to be physically active at all. One important way we can fix the risk of obesity and different health problems for our future generations is by mandating a specific amount of time allowing students to engage in moderate to vigorous physical activity, also known as MVPA. If you don't know what MVPA is, a few examples are dancing, tennis, brisk walking, and slow biking. According to the American Heart Association in 2018, kids 6 to 17 years old should get at least 60 minutes per day of moderate to vigorous intensity physical activity, mostly aerobic. So, in other words, our high school's policy needs to mandate at least 60 minutes of physical activity within their physical education classes. Saying this, the policy also must mandate high school students to take physical education classes every year to make sure that they are receiving the proper amount of MVPA, unless, of course, they're a part of some sports team or something like that. Now, do some people say that physical education is not important and is taken away from some more important areas in schools? Of course. Well, do some people also think that future health problems cannot be solved through childhood physical education? Yeah. For example, in the article titled The Impact of Physical Education on Obesity Among Elementary School Children, written in 2013 by John Colley and his co-editors, they state that despite the recommendations of the Surgeon General, CDC, and others, there's little evidence of a causal effect of PE on youth obesity. There are several reasons that additional PE may not lower weight or the risk of obesity. Saying this, in his article, Colley did make some strong points on why physical education does not make a big difference regarding our future health issues. Therefore, there's research that supports both sides of this argument. So ultimately, it's your decision for what you believe in. But what I want you to think about is, what would you want if it were your child? Would you want to risk it and settle for the poor physical education they're receiving now, or take charge to ensure your child's future health? So after all this, you learned about some major health problems in America and how to try and fix them through better childhood physical education. Saying this, I want you to think back to your high school PE class again and ask yourself what you would change. And once you've done that, I want you to take that idea and fight for it for the sake of our future generations. Thank you.